Hey everyone, we're live. My name's Dr. John Robinson.
And I'm Dr. Christina Bosch.
And we are
the Sex Doc.
The Sex Doc. We don't have our sign today to prove it. You're just gonna have to trust us today. But here we are out in the middle of the Arizona desert. Not really, but we're over at Gateway in Scottsdale. Coming out for a little bit of a hike here in the middle of the day. Just ate lunch and thought we'd come out here and take a quick hike.
Stroll.
Yeah, stroll. Get back to the office here pretty soon. But this is the great advantage of living in Arizona, being able to come out here in the middle of the day when it starts to get beautiful this time of year.
Oh, it's so pretty.
Yeah, what are we going to talk about today?
Well, we are going to deviate again. Spontaneity is one of the spices of life, everybody. But we're going to deviate again because we just got back from that LDN, the Low Dose Naltrexone conference that we referenced prior to leaving, where John spoke and did a fabulous job and learned so much and so many interesting things that we thought, let's just share some of those clinical pearls with the audience. And just get that conversation and that awareness going a little bit more. So that's what we want to focus on today, yeah?
Yeah. So LDN, again, it was the LDN Research Trust. And Linda Elsagood, if you're listening, thanks again for doing an amazing job. You are a light to the world and bringing this idea of low-dose naltrexone to the entire world. They're actually out of the UK, and doctors and scientists came from all over the world to come and speak at this conference. Some really amazing experts.
Amazing speakers, volunteering their time. Yes. They were not reimbursed in any way. This was literally labor of love for the physicians, and we were very proud and privileged to be a part of the team.
Yes.
Yeah.
And so, yeah, my specific talk was on the work that we've done on lowering antibodies, thyroid antibodies, using this medication called low-dose naltrexone. The really great thing about this medication, aside from the fact that we've really found that it worked, we kind of presented this data that it really is working. Aside from that, the side effect profile is so amazingly low.
Yeah.
We don't really see anything really with it. And it just has this great benefit of modulating the immune system and helping people with all kinds of autoimmune conditions. But we were learning extra things aside from just that,
We
right?
did. So we'll focus on what we presented and the relationship of LDN with Hashimoto's. But some of the things that we learned was that LDN, low-dose naltrexone, is even safe and effective in pediatric cases, which was awesome because my patient base in particular is getting younger and younger. So for those people that are themselves positive with Hashimoto's, and especially if you have a partner that is also hypothyroid, go get your young ones, your preteens checked. Establish that baseline because you can definitely practice prevention.
Yeah, and by the way, hi Alessandra. She's watching. Hi Julie.
Hi Julie.
So the other thing, I wanted to mention, I really recommend, we're a little bit backwards here. We don't normally do it this way.
Luckily, it's just initials, LDN.
LDN, the LDN book. I really highly recommend this book. It's a list of experts that went in and wrote these different chapters. It was edited by Linda Elsagood, who is a major part of the LDN Research Trust. And yeah, it's just really a fantastic resource and not a small book either. So,
but this book is written for the layperson, even though it has all of the clinical research supported in the back of the book. But here's the thing about LDN. Again, we're going to talk about it in a very disease-specific fashion, but what we really took away from that conference is that this applies to all of us. This really can be seen as an anti-aging or graceful aging aid because it is decreasing your immune reaction, decreasing general inflammation, and applicable to so many chronic inflammatory conditions. Anything from psychiatric conditions like PTSD or post-traumatic stress to dealing with diabetes, to of course thyroid issues, anxiety, depression, gut issues. I mean, it's a powerhouse medicine.
It is, and one of the things that we actually saw on the last day were two scientists that were talking about their use of LDN with traumatic brain injury. So back to what Christina was just saying about this idea of as it being an anti-aging medication. In there's many theories of aging. One of the key ones is brain health. And so kind of where the brain goes is where our rate of decline in terms of aging will go. And so if we can enhance our brain function and decrease the likelihood of disease developing in the brain, then we can live longer.
Yeah.
And so really, really cool stuff with working with TBI, and it's amazing not understanding how common it is to see TBI, and now, with sports injuries.
TBI is traumatic brain injury.
Yes,
I'm not sure if you
traumatic brain injury. So
with kids,
kids and
starts early on.
Yes, and a lot of times is what we also learned. A lot of these things do not manifest until years later, maybe up to 3 years later before you see the full negative effects of what a traumatic brain injury will cause. And so if you're using something like LDN, it has this capacity to sort of clean up some of that damage and prevent some of that progression that goes on in the brain. Again, just as one example.
Yeah, and this is still a prescription, so you of course want to engage your physician in this conversation, but engage them in the conversation. That's the point. In fact, for myself, I learned about naltrexone through a patient. A patient came in and said, "Hey, I've heard about this. What do you think?" And I said, "I have no idea what this is. Let me research it." And this is why having open communication with your physician is so important, because together you will form a much stronger front. A clinical pearl from the conference is that we, for the most part, get a new body every 7 years. That means that any type of our cell, each type of our body's cells, whether it's skin or intestinal, whatever, all those cells have a certain lifespan, and all the cells in the body have at most a 7-year lifespan. Some of them are 3 months, like red blood cells, for example. So what that means is that if you're having oxidative damage, which you've all heard about, oxidative stress, like eat your blueberries, they're antioxidants. We have oxidative damage from the environment, from our diet, from medicines, from antibiotics, from emotions. So that oxidative damage decreases the quality and the quantity of your cell regeneration. So if you think about every 7 years, you have the opportunity to either have fresh, new, spanking, bright, I don't know what I just said, good cells.
We're spanking those cells. I understood what you meant.
I
hey,
imagine
Nathan.
They all did.
And Nathan just joined.
The cells can either be nice and brand new and good, or not regenerated with the same quality or the same quantity. So this is one of those things when you're thinking about overall health, anti-inflammation, general health. Again, low dose naltrexone.
Here's another great thing that we learned. One of the things that I think is really exciting about LDN is the use of LDN in cancer. So cancer is not something that Dr. Bosch and I directly work with. We indirectly work with it because, again, we're always thinking about the idea of age management and healthy aging and antioxidants, all these things that we know set up the environment for cancer to grow. We're working on it on that level.
Or rebuilding post-cancer therapy.
Yes, which we work with those kind of patients all the time. But as far as an actual treatment for cancer right at the moment, LDN really stands as something really promising. And we have Dr. Anderson, Dr. Paul Anderson, who's really within the naturopathic world and now really in the midst of just medicine in general has become quite the star, and he's been using it, and he presented some of his information on that, and we're just seeing a growing body of evidence of some of these, quote, alternative kind of therapies like LDN being able to be complementary along with cancer treatment. So there in the audience, by the way, at this LDN conference was William Hurt. So apparently we were in Portland, and I think he's from Bend, Oregon. So there he was attending this conference, so kind of a superstar there checking this all out.
Definitely.
We remember William Hurt. There was a great movie called The Doctor. I think it was The Doctor. And William Hurt played this sort of arrogant...
He was an oncologist.
Yeah, he was an oncologist, sort of arrogant, kind of had got somewhat jaded, patients coming in and he not really having compassion for them. And then his arc in the story was that he got cancer himself and became a patient.
It's a really sad movie.
Yeah, and then he went through his whole process. But it was
really sad.
very sad. But it was very sort of brilliant to watch that process. But anyway, there he was as a patient talking about it all. So yeah, it seems like LDN is gaining more and more popularity. What else do you have to say?
Something that I found to be really interesting for the discussions nowadays are notions of medical marijuana. So there are many states, especially over here on the West, that have approved the use of cannabinoids for medicinal purposes. One of the speakers presented the notion that we have discovered that there are endocannabinoid receptors in our body. endo meaning it's coming from within you. So that means that there are stimulants, there are chemical stimulants that you can take that is not cannabinoids for those of us who either are not using or are not interested in using marijuana or do not have access to it. There are other things that one can do to stimulate your CB1 and CB2 receptors so that you have the benefits of increasing the well-beings of what a medical marijuana might do. So this was a really interesting thing to learn. And apparently low-dose naltrexone
influences that
again, this
system.
is new for me, so don't quote me on this, but what I'm trying to do is introduce a new idea. It will influence the system. So it has two things. One of them is that it self-act on those receptors, mimicking cannabinoid use. But the other one, I believe I understood correctly, was that it also makes them more sensitive. So that if you are using medicines that stimulate those feel-good receptors,
CBD oil being one thing.
you don't need as much, which is always an important thing in medicine. The less you need to use, the better.
Yeah.
You don't run through your doses as quickly, and usually with lower doses of things, you have a smaller side effect profile. So that was also really cool.
Yeah, and I think a lot of that we were learning, listening to Dr. Nasha
Naisha
Winters,
lovely woman.
Beautiful woman, has had her own journey that she openly talks about, her journey, a 26-year journey with ovarian cancer. I mean, she's 26 years in remission from that, and what she did naturally to be able to help with that, and she's also a naturopathic physician. And check out her new book. I can't think of the name of it right now, but Naisha, Nasha Winters, Naisha Winters. Check out that book too, and what she talks about.
That's great. These are pioneers.
Yes.
This is an exciting era that we have, that we're living in, and that all of you watching and those of you that tune in, we really have the privilege of being so open-minded that we're returning to the simplicity of medicine, which is the notion that your body has a lot of ability to do more for itself if you're listening and if you give it less toxic interventions. It's a wonderful thing. One of the other things that we learned that Dr. Winters at Naisha spoke about, as did many of the physicians, was this theory of leaky gut. We've talked a little bit about this on our videos.
Yeah, we've talked a lot about leaky gut, and just if anybody has leaky gut in general, being on LDN could be a huge adjunct to what you're already doing. Of course, with looking at food allergies and going through certain supplement regimens that are going to help to heal the gut. But there's such a reactivity that happens, an immune reactivity that starts, a cascade that starts to happen in the midst of leaky gut, that one way to modulate that could be LDN.
Through use of LDN. So remember, part of our mission here as the sex docs and as the physicians of the Hormone Zone is to empower you, especially those that are not available to see us, to empower you to go out there and break down some barriers when speaking with your physicians. One of those barriers is the notion of leaky gut. Leaky gut is not yet recognized as an official diagnosis if you use the words leaky gut. And many physicians are quick to say that that's nonsense, it's poo-poo, you don't have leaky gut.
Well, the word to use is gut permeability. And in
finish my sentence.
Oh, I'm sorry. Did I cut you off? We need to have like a beeper or something.
No, those are just regular social cues.
I didn't catch the social cue.
Yes, he's correct. The term that you want to present.
Gut permeability. Gut permeability.
is increased intestinal permeability.
Yes.
Not gut permeability.
Oh, not gut permeability.
Increase.
That's what I meant.
Intestinal permeability. So there you go. One more wonderful clinical pearl.
Yeah.
If you're having constipation, diarrhea, or alternating between both, you may be suffering from irritable bowel syndrome. You may be having increased intestinal permeability.
Intestinal permeability.
All of which would drastically benefit from LDN. Okay?
Yes. I like this, we work a lot with fibromyalgia.
Oh, goodness.
And sometimes even the things you work with all the time, just in the midst of just working with patients, you sometimes forget even the simplest basic things. So doctors sometimes can make things complicated. And we learned relearned a great clinical pearl about fibromyalgia. And if you believe you may have fibromyalgia, which is this condition where it normally comes with a lot of pain, body-wide pain, diffuse pain.
History of trauma, usually.
Yeah, trauma often is sort of preliminary to that. But if you are in pain while you're sleeping, and you're always in pain while you're sleeping, then more than likely it's fibromyalgia. If you think you have fibromyalgia, but you really don't have pain while you sleep and you pretty much sleep all night, it's probably not fibromyalgia.
So look for another diagnosis.
And I think that was, I think it rang true for us, because I think we know that that is true about our patients, and so it's something important to remember.
Fibromyalgia is one of those catch-all, right? One of those diagnoses that basically it's a diagnosis of exclusion, meaning they didn't find anything else, so therefore they're assuming that it's fibromyalgia. And one of the issues with that is that once a conventional physician, a conventionally minded physician says, oh, you've got fibromyalgia, then perhaps they stop looking further to see, well, what else might be there? From our perspective, we know that thyroid hormone resistance is a huge contributor to fibro, and what this is expressing is that you may just not have the diagnosis of fibromyalgia, but perhaps you're just having chronic, inflammatory, widespread pain that can be addressed more effectively if you don't just label it as fibro. I wanted to,
and that may be LDN helping.
I just wanted to show our viewers here.
That's the last thing.
This is why I keep looking down. These are my notes.
Don't try to read them. Don't try.
Don't hurt yourself. Listen, in med school, I was always known for having really good notes. Sometimes I couldn't understand my own handwriting, but once I did, my notes were awesome.
And I had really good handwriting. I still do, but I couldn't write as fast.
Fractional notes.
So yes,
together, it's like Voltron. Together, we form a strong team. Well, perhaps our artisans today is not so specific to the notion of sex, other than if you feel good,
you're going to want to have sex.
You're going to want to have sex. Perhaps our artisans for today is, again, the notion of spontaneity and just intellectual sharing and how stimulating it is to not just rely on, touching and kissing and rubbing, but connecting, mind to mind, heart to heart, something that we share a passion for.
That's always been easy for us, I think. We share so many things, so many key things about who we are as people. And so we're really happy to be able to bring that to you. So after all of that, about LDN and all these other things, here's what we definitely know for sure.
Hormones are sexy.
Definitely sexy. And LDN is sexy. We had a hell of a lot of fun this weekend.
We did.
We're really happy to be able to talk with you about it now. And if you have any other questions, we're here for you. Next week, I don't know what we're going to be talking about, and I don't know what venue we'll be in, but hopefully it'll be something as beautiful as this. You ready to go for a little stroll?
Most definitely, yeah.
All right. We'll see you next week.
Thank you. Have a great week.